All of these models are in your lab or lecture book. So here is the nasal cavity. And now this is the external nares, otherwise known as the nose. And inside here would be the internal nares. We're not going to worry about all the different things inside here, but just internal nares, external nares, or the nose. And now this is the palate. Look where the pin is moving, that's the palate. If we turn over to the digestive system, they ask us to give parts of the palate. So we're in the oral cavity. So from here, this is the palatine bone, and anything that is under the palatine bone would be the hard palate that I'm touching now. This is skeletal muscle, and so from there to there would be the smooth, soft palate. And this V-shaped structure is the uvula. So for the respiratory system, they just ask us to identify the palate. But the digestive system asks us to divide it into parts. Under the bone, this is the bone, would be the hard palate. From there to there. From there to there is the soft palate. And this V-shaped structure is the uvula. So now we go back to the respiratory system. The tube in the throat, that is the pharynx. Tube in the throat is the pharynx. And then we move now to the larynx. The larynx is down there. But we have a better way of identifying the larynx. Remember, this goes very quickly. Here's and where I'm not adding on anything here. That's the larynx. This is a hyoid bone that you studied before. So they ask us to point out parts of the larynx. This is the epiglottis. That's the epiglottis. The whole is the glottis. And part of the larynx, the blue, represents the thyroid cartilage. This is the part where in men it pronounces to become the Adam's apple. So here's the thyroid cartilage in blue. There are other cartilages in the back that we're not responsible for. Just responsible for this one in front, which is the thyroid cartilage. Okay, so we have a smaller version of the larynx, again with the epiglottis, the glottis, thyroid cartilage in front. And now we can open this one. And we open that in white. This would be the glottis. In white would be the true vocal cords or the true vocal folds. And on top that is not white would be the false. They don't ask you for the false, they just ask you for the true one. And the white one, the white represents the true, that's where the sound is coming from, the true vocal cords or vocal folds. Now we're moving along, and this would be the trachea. Here is the trachea, and the trachea has now rings. So in blue, and the question will be specific, this would be the cartilaginous rings. If I go across, I'm looking for the word trachea. If I stay on the blue, it's the cartilaginous rings. And now the trachea splits into two primary bronchi. And it's going to be specific. So it's on the table, you can't pick it up. This is my right hand, therefore this would be the left primary bronchi. This is the right primary bronchi. So we're not going to worry about the bronchioles. This is a trachea. If I stay on one, it's the cartilaginous ring. This would be the left primary bronchi, right primary bronchi. If I use this, again, trachea, and you have the left primary bronchi and the right primary bronchi. Now, moving along, we're now at the lungs. Any questions so far? Left lung, because it has only two lobes. This would be the superior lobe, and that is the inferior lobe. So again, you have to be specific. If I tag this, it's the superior left lobe of lung. If I tag this, this would be the inferior left lobe of lung. Now let's first. Superior, middle, and inferior. So again, be specific. This would be the right superior lobe. This would be the right middle lobe, and this would be the right inferior lobe, right? This is the right lung that has 3 lobes, but 2 fissures. These are the fissures. You had it on the test number 4. 3 lobes, but 2 fissures. The lines are called the fissures. Lower lip, or lower labia. And then ask us to point out now the salivary glands, and only one. In the lecture we mentioned a picture. So this is the parotid gland that lies right behind the masseter in front of the ear. That's the only one they ask us to point out, the parotid gland. If I use this one, same thing. This would be the central, and the question will be specific. Central incisor, lateral incisor. The pointed one is the canine. These 2 are the premolars, and you have 2 molars. The wisdom tooth is not there yet. So central incisor, lateral incisor, canine, premolars, and molars. And then we come now to the tongue. This is the sagittal half of the tongue, and the palatine tonsil. So we talk about tonsils today. So here you have, this would be the nasal tonsil, and then there's one in there, it's a better model to show the oral cavity. Again, it shows you the hard palate, soft palate, and the V structure is the uvula. This right there is the palatine tonsils. This is the oral cavity. Tongue was taken out. This is the palatine tonsil that is tested. So what you're seeing here is this is in the nose, that would be the adenoids or the nasal. So the one down here is not shown well, so this is a model that has the palatine tonsils very well. Pharynx is the pharynx close to the nose, oropharynx close to the oral cavity, and the laryngeal pharynx down here. So again, nasopharynx, oropharynx, and the laryngeal pharynx near to the voice box. So let's do the same thing you're seeing here, smaller portion. If you do like this, you're seeing the taste buds on the tongue. So if you see this on the test, it is the tongue. Now, let's do the esophagus. Trachea, and lying behind the trachea, this tube represents the esophagus. This would be the aorta. And now we come to the stomach. The end of the esophagus. And so the parts of the stomach, which we mentioned in the lecture today, right here is the cardiac region, close to the heart. This would be the fundus. This is the body of the stomach, and down here is the pylorus. So the cardiac region, the fundus is here, the body or the corpus, and comes the pylorus. So we have 2 rings of muscles. So here, since it's a cardiac region, this ring of muscles would be the cardiac sphincter. Sphincter means a ring of muscles. The cardiac sphincter is right there. Since this is a pylorus, this would be the pyloric sphincter. So to repeat, cardiac sphincter, fundus, body, pylorus, pyloric sphincter. Okay, we're not going to go inside of the stomach. Today you saw in the lecture that it's folded, but it's called rugae, so I'm not adding anything there. This is also the stomach, showing the pyloric sphincter over there. Sorry, the cardiac sphincter, the cardiac region, fundus, the body, and the pylorus. But you can't see the sphincter because it's blocked. This will be the first part of the small intestine, called the duodenum or the duodenum. And by the way, this is the pancreas. So you have the head of the pancreas, the tail of the pancreas, and this will be the body of the pancreas with the pancreatic duct. So again, remember, this is the first part of the small intestine, called the duodenum or the duodenum. Yes?
Which one's the fundus?
The fundus. So cardiac region, fundus, body, pylorus. This is much better because you can see it a little cleaner. It's cleaner. Here is the cardiac region. the cardiac sphincter, the fundus. Here is the body, and the pylorus, and the pyloric sphincter. We're not going to go in. And this is the gallbladder in green, because the bile salts are green. So again, the liver, not going to ask about the lobes, gallbladder. Now, let's talk about the pancreas. So here is the pancreas, the head of the pancreas, the tail of the pancreas, the body of the pancreas, and that white tube is the pancreatic duct. So let's show you another model of the, again, the first part of the small intestine, the duodenum, otherwise get pronounced as the duodenum. This is the pancreas, head of the pancreas, tail of the pancreas, body of the pancreas. The white represents the pancreatic duct. And now we come to the, I've already showed you the first part of the small intestine is the duodenum or the duodenum. Here it is also the first part of the small intestine. And now we look for the jejunum and the ileum. And very important, head, tail, body, and the pancreatic duct. The first part of the small intestine, the duodenum or the duodenum. You can't really distinguish the jejunum because you don't see where it actually stops. So I'm not going to test you on the jejunum. But the last part of the small intestine is called the ileum. So here's the ileum. And where the ileum and the cecum, this is the first part of the large, where it meets, there's a valve, and that's testicle. So here's where the ileum stops, and this is the ileocecal valve, that's testicle. Not going to test you on the jejunum, it's in the middle, we don't know where it starts. But here is the ileum, the last part of the small intestine, and this is the ileocecal valve. And now we get to the large intestine. The large intestine for the lecture, 4 parts: the cecum, the colon, the rectum, and the anus. But now if we're looking at parts of the colon, here is the ascending colon, the transverse colon, the descending colon, where it makes an S, it becomes the sigmoid colon, and then the rectum and the anus. So again, to repeat, if you're asking the lecturer to name the 4 segments of the large intestine, it would be the cecum, the colon, the rectum, and the anus. If you're asked to name parts of the colon, the ascending colon, the transverse colon, the descending colon, sigmoid colon, parts of the colon.
Which is the sigmoid again?
Sigmoid. So the sigmoid is down here, it makes an S curve. Sigmoid. So ascending, transverse, and here is the descending, and where it makes an S, it becomes the sigmoid colon. See? You can see here, it's making an S curve. So now the features of the large intestine. The pouches are called, they heard it today in the lecture, what is it? Haustra. Haustra or haustrum. And the band of connective tissue testicle, that's the tena coli. So you have it on your checklist, the tena coli and the haustra. And anything else? And by the way, this is the appendix, has nothing to do with the digestive system. It's just that it sticks out from the cecum. It's a lymphoid organ. So to repeat the large intestine, here you have the cecum, ascending colon, transverse colon, descending colon, sigmoid colon, the rectum, and the anus. The haustra are the pouches, and this band of connective tissue called the tena coli. Any questions on the digestive system? See, it's very easy. Spleen is on your checklist. It actually came from the end of the pancreas, so it sticks out there. The spleen, you only have one spleen on the left-hand side of the body. That's the spleen. Here's also the spleen. Now let's do the urinary system. So we're going to look at the, and out here would be everything pertaining to the kidney is renal. Renal capsule, the covering of the kidney. Renal capsule. Again, renal capsule, covering of the kidney. The indentation, that would be the hilus or the hilum. And that's where the blood vessels are leaving and entering. So red would represent what? Hello, going into the kidney? Renal artery. And the blue leaving? Renal vein. And what is this leaving? The kidney. Ureter. So again, here is the kidney, the renal capsule. Renal capsule. This is the hilum. And the red represents the renal artery entering. And this is the renal vein leaving. And this is the ureter going to where? The urinary bladder. And so now we're looking. And here again would be the renal cortex. That's the renal cortex. And the innermost part would be the renal medulla. Renal cortex, renal medulla. And each, the medulla is divided up into little pies. What I'm pinning now is the renal pyramid. So these are the renal pyramid. And I said in the lecture, it's not mentioned, so you don't have it, but in the lab you're responsible for it. At the tip of each renal pyramid would be the renal papilla. That's where the urine drains out. Renal papilla, renal papilla, renal papilla, at the tip of the renal pyramid. And then you have some sinuses. Sinuses are actually cavities that collects the urine. So the minor ones, minor calyx, minor calyx, minor calyx, and the minor calyx opens up, these two are minor, opens up into a larger sinus that becomes the major calyx. And then right here would be the renal pelvis. So let's repeat the internal portion of the kidney. Here is the renal capsule, the renal cortex. If I go across 2, it would be the renal medulla. If I stay on 1, it's the renal pyramid. If I go to the tip, the renal papilla. If I go into the little cavities, which would be the calyx, the smaller one is the minor calyx. 2 opens up into a larger one. That would be the major calyx. And all of the calyxes let down the urine into the renal pelvis. And this represents the ureter. Any questions about the internal portion of the kidney?
Where is the renal sinus?
The sinuses are the calyx. You notice that there's an indentation there. So the renal sinus represents the major calyx and the minor calyx. Sinuses mean a cavity. So that's where the urine drains. So this would be the minor calyx opens up into the major, which are the renal sinuses. Showing you the renal capsule, and we can open this. And so you're seeing the hilum. Again, this would be the renal medulla, the renal cortex. Capsule is on the outside. And you're seeing the calyx. And when they open up into the major calyx, and down there would be the renal pelvis. And these 2 tubes now that are leaving the kidney, what are they? Those are the ureter. 2 ureters leaving the kidney. And it empties where? Into the urinary bladder. And look very carefully now. These are the end of the 2 ureters. It fits down in there. The 2 ureters. And this would be the urinary bladder. And this 1 tube that leaks out the urine is called what? Urethra. U-R-E-T-H-R-A. Urethra. This happens to be male. This is a male model. Why is this a male model? It has some features there that belongs to the male only. So what is this? Don't tell me gonads. This is a prostate gland. So that's why we know that this is a male model. prostate gland, and these would be what? Seminal vesicles. Seminal vesicles and the prostate gland. So that's why we know it's a male model. So again, any questions on the kidney? Any questions on the urinary system? So now we go to the fun part, the reproductive system. Let's turn over. Attention, that is the scrotum out there, and this represents what? The testis, and right on top of the testis is the epididymis. So sperms are made here, and they go to the epididymis where they become matured and where they are stored. And this tube leaves epididymis carrying the sperm. What is it? And it enters the male body, passes through the little diaphragm, and comes inside of the body and goes right around the urinary bladder. So what is this tube called? The vas deferens, otherwise known as the ductus deferens. Must know your system. So again, scrotum, testis, epididymis. Here is the vas deferens or the ductus deferens that carries the sperms. And now it goes right inside of the body. It was hanging outside, and it goes around the urinary bladder. So let's follow the vas deferens, see where it's going. This is a seminal vesicle, the same one that we saw on the outside near the urinary bladder. So the seminal vesicle releases what? Semen. And so now the sperms will now be floating in the semen, but this duct is called what? The ejaculatory duct. And this would be what? The prostate gland. Location. Where is the other model with the bladder? Here is the urinary bladder, and I told you that it's a male model because it shows the urinary bladder with the prostate gland very close. And these are the seminal vesicles. This is the end of the ureter. So we are looking at it from this model now. Here is the vas deferens that comes around. Goes around the urinary bladder. And the urinary bladder, below it, would be the prostate gland. This on the side, similar to that, is the seminal vesicle. And so now this carries the sperm and the semen, and this is the ejaculatory duct that's going to empty everything through what? What is this tube? That goes through the prostate gland, through the penis, and carries everything to the outside of the body. What is a tube? What is a tube? Can't be the ureter. Urethra. The male has a very long urethra. That's why they have no problem with UTI. So here is the urethra leaving the urinary bladder, passes through the prostate gland. It's carrying urine. It can also carry the semen with the sperm, and it passes right there. And this is called the urogenital diaphragm. So that would be the membranous urethra. And then all of this is the penis, and it runs through the penis, the longest part of the urethra, and that's called the spongy or the penile urethra. So the male has three parts. If you notice here on the sheet, it tells you three parts of the urethra. So if I pin there, I'm looking for what? The prostatic urethra. If I pin this, I'm looking for what? Membranous urethra, because here is the urogenital diaphragm. And if I pin down there, I'm looking for what? Penile or the spongy urethra. Three parts. When it passes through the prostate gland, it becomes the prostatic urethra. Through here is the membranous. And any place through the penis, it becomes the spongy or the penile urethra. Now let's go back to here. I've already showed you the scrotum and the testis and the epididymis. And I showed you the ductus or the vas deferens. I showed you now the spermatic cord. This is part of it, but we have a better model to show the spermatic cord. The spermatic cord would include the testicular artery, the testicular vein, the vas deferens, premaster muscle. All of that is part of the spermatic cord, but better shown on another model. And now I showed you the prostate gland. I showed you also the seminal vesicle. And right here, there's a gland right there that also releases semen. That's the bulbourethral gland, also known as the Cowper's gland. that releases semen. So 3 places releases semen: the prostate gland, the seminal vesicle, and the bulbourethral gland. Now let's talk about the penis. The covering on the outside is the prepuce or the foreskin that should be removed at day 8. At least that's the latest, day 8 or before the newborn male leaves the hospital. So the prepuce or the foreskin. Right here, the head of the penis is known as what? The glans penis. And now, some beautiful names. On either side of the spongy urethra, on either side, that's called the corpus spongiosum. Corpus spongiosum. And this is the erectile tissue. And the erectile tissue has a very fancy name, and the name is what? Corpora cavernosa. Corpora cavernosa, or the erectile tissue. So here's the erectile tissue. If you say erectile tissue, you'll get it right. It's corpora cavernosa. Here's the corpus spongiosum. And here's the glans penis and the prepuce. Any questions on the male? So let's show you the other models that I'll also be using. Male reproductive. And what would this be? Urinary bladder. And this is the prostate gland. And so passing through the prostate gland, it would be the prostatic urethra. And membranous diaphragm is right there, so this would be the membranous urethra. And the red represents the penis, so this would be the spongy urethra. And now on either side of the urethra would be the corpus spongiosum. And this, you can see the bars again, erectile tissue, corpora cavernosa. So once you learn it on one, supposed to pick it up on the other. And what would this be? Scrotum with the testis inside. And what do you think that this is now? See this on the test? No, it's not a sperm. The testis. The testis. And this is actually outside of the testis, the scrotum that has some muscles. These are muscles on the outside. So the outer skin is torn off to show the muscles. So you'll hear about the muscles in the lecture, because during cold weather, these muscles contract and pull the testis closer to the body just to get some heat, so that not killing the sperms. And what would this be sticking out there? The vas deferens or the ductus deferens. And up here would be what? Spermatic cord. So now you have the spermatic cord include some of the muscles, include that you don't see the testicular artery, testicular vein, and the creep. That's called the cremaster muscle. Let's show you another testis. What is this on top of the testis? No, you have already taken off the scrotum. So you're seeing the testis, and this would be what? Epididymis. And this spermatic cord, the spermatic cord that includes the testicular artery, testicular vein, and this, what is this? Vas deferens. Okay. And now, what would this be? Same thing as we saw on the other model. What is it?
Urinary bladder.
Urinary bladder. And what is this?
Prostate gland.
Same thing like over there. Same thing like that. What is it? Same thing like this. Seminal vesicle. This is the urinary bladder. You're seeing the same thing. Seminal vesicle. This is the vas deferens, spermatic cord, the testis, the epididymis. And now this would hidden inside. Not going to open it yet. Location is important. What is that? Prostate gland. Prostate gland hidden in there. Same thing you're seeing there. And so now we open it. Urinary bladder, prostate gland. Here is the prostatic urethra, the membranous urethra right there. And this would be the spongy urethra. You're not seeing the rest of the penis. And this would be the rectum and the anus. So let's look at the other half. Again, here is the urinary bladder. Here is the prostate gland, prostatic urethra, membranous urethra, spongy urethra. Again, this is the seminal vesicle. You're seeing the prostate gland when you cut it in two. Any questions on the male reproductive system? No? I'm going to add to your list is the finger-like projections that hangs over the ovary to catch the egg when the woman ovulates. And it's called a fimbriae. And I'll put it on the board, Fimbraie. So here's the ovary, fimbriae. And what is this now, ladies? Fallopian tube, otherwise known as the oviduct, otherwise known as the uterine tube. So you can say fallopian tube, you can say oviduct, or you can say the uterine tube. And this would be what? Uterus. And right up here is the fundus. That's the fundus of the uterus. Oh, one thing I didn't show you in the kidney, which is testicle. Let's go back to that. This is the adrenal gland. That's the adrenal gland that sits on top of the kidney. Remember, you were tested on the suprarenal vein today? That's the adrenal gland that sits on top of the kidney. So the adrenal gland, is it on your list? No, it's not on your list, so we leave it off.
Suprarenal, the very top.
Oh yes, it's there. Suprarenal glands or the adrenal glands. Okay, let's go back to the female. So here is the ovary, the fimbriae, the fallopian tube or the oviduct. This is the uterus. And here is the fundus of the uterus. And this would be the body of the uterus. Though the lips or the mouth of the uterus is called what? The cervix. And this long tube is called the vagina. And this would be the end of the large intestine, the rectum, and the anus. And now this is comparable to your corpora cavernosa. So what is it, females? The erectile tissue, the females are called what? The clitoris. The clitoris. So now you see the word vulva. Vulva means external genitalia. And the external genitalia in the female include these two lips that protects the opening of the vagina. Labia minora and labia majora and the clitoris. All of those items are part of what is known as the vulva. So here you have the vagina, you have the cervix, you have the body of the uterus, and the fundus is up there. And by the way, when the fallopian tube makes a curve, right there is called the infundibulum. So here's the fallopian tube making a curve, right there would be the infundibulum. Let's see if you can spot it on the other model. So what are these? Ovaries, and you have the fimbriae hanging over the ovary to catch the egg. And this would be what? Uterus. And this would be what? Fallopian tube. And you have the urinary bladder down there. So now we're looking at 1/2. So again, here is your uterus, and the lips or the neck is called what? The cervix. This long tube is the vagina, and this is the urinary bladder with the urethra. You notice that the urethra in the female is very short. That's why they have problems with UTI. The male urethra is very long. So here's the urinary bladder. That's the urethra. And again, you have the two lips, labia minora and labia majora. And right there, what is this? The erectile tissue, which is called what? The clitoris. And see, nothing else that is testable on here. Let's go for another model. Once you learn it on one, you're supposed to be able to pick it up on the other. Folks? That's the uterus. That's the uterus. So this woman is pregnant, and here's the embryo attached to the inner wall of the uterus, and here's the plug, and this would be what? Vagina. So this is the plug to hold the pregnancy in place, and so when the woman water break, this plug is loose now, and the water start to pour out. That's the amniotic fluid, by the way. So here is now a larger fetus inside of the uterus. And this is showing you now both sides. So now you have ovary, it's open. For the fimbriae. So you have now the two fallopian tubes, and right up here would be what? Testicle? It's a uterus, but what is the question will be specific. The fundus. The fundus. Very good. And down here would be what? The cervix. And this is a portion of the vagina. Okay. Once you learn it in one, you're supposed to be able to pick it up in the rest. So now you have a handout. I'm going to tell you. Now have to tell me what it is. What is this?
Ovary.
Ovary. What is this?
Fallopian tube.
Fallopian tube. What is this?
There you go.
Hanging over the ovary. Fimbriae. And what is this?
Uterus.
Uterus. And cervix. And what is this? Vagina. And now the two lips have the labia minora and the labia majora, and right out there would be the clitoris. Position is important. This would be what? Urinary bladder. When the woman is pregnant, this is now pushing against the urinary bladder, so she goes to the bathroom quite often. This is a urinary bladder next to the uterus, and here would be what? Urethra. That's the urethra leaving the urinary bladder to leak out the urine. So you notice that the female has three openings: the rectum to release the feces, the vagina for the entry of the sperm, and the urethra for the urine, to leak out the urine. The male, if you look at it, it only has two openings, one for the feces and one opening for both the sperm and the urine. Okay, but of course they are not released at the same time. Digestive and respiratory system on the cat. But you see, the cat has similar thing. This is the trachea in the cat. Same thing with the rings of cartilage. This is the voice box up there. So when the cat says meow, meow, the sound is coming from here. And here is the esophagus that runs behind the trachea. Are we listening?
Yeah.
Okay, so here's the trachea, here's the esophagus. And the cat also, here's the heart enclosed in the pericardium. Remember I said the pericardium is actually a bag that encloses the heart. We're not going to open it, but just to show you that the cat, here are the lungs. It has 7 lobes. So here you have the superior lobe, middle lobe, and inferior. And on the other side you also have superior, middle, and inferior. And then you have in the middle, down here, is the mediastinal lobe. So those are the lobes. Now the diaphragm. And here is the liver. And this represents what? Gallbladder. And now all of this is small intestine. And the fat, this is the omentum, the greater omentum, where I said fat collects in there. And now here, what I want to point out to you is that here is the stomach. And right behind the stomach, you have so when we take the stomach and lift it up, behind there you'll have, this is the pancreas, hiding behind the stomach. That's the pancreas right there. Now, this is where now your test is going to be involved. These are the kidneys. So here's one kidney, and here is the other kidney. This is a female. Watch carefully now. This is a urinary bladder. That's the urinary bladder right there. And this, what is this running from the kidney into the urinary bladder? This tube. That's the ureter. So that is the ureter going from the kidneys up there. Just showing it to you on one side, and it empties into the urinary bladder. So the urinary bladder is testable. The ureter is testable. And now if you look at your sheet, the picture that I gave you, the cat is capable of having more than one
2 horns.
Babies at the same time, because these are the horns. These are called, they're not called fallopian tubes, they're called the uterine horns. And so they can have more than one kittens inside there. So this is the uterine horns, and the uterine horns ending right there, which is the uterus, the body of the uterus. So uterine horns, body of the uterus is right there. And now here is the urethra, and where the urethra leaves the urinary bladder and joins right below the uterus where I'm pulling out, this would be where the pin is now, is going to be the vagina. So here is the urinary bladder. This is the urethra. The urethra enters down here to becomes, so you have the body of the uterus is there, body of the uterus, where it enters right into the vagina. That's the female. So what you can be tested, and very important, let's go back. Here it looks like a little seed. That's the ovary. That's the ovary on one side. So if I pin right in there, that's the ovary. You see it in your picture that I gave you. And on the other side is the ovary. So ovary, uterine horn. Ovary, uterine horn. Urinary bladder, and that is the body of the uterus. And below the body of the uterus, this is the urethra. Where the urethra enters the uterus will be, the opening will be the vagina. So that's the female. Now let's look at what? On either side of the urinary bladder, one was cut. Let's get the word. Seminal vesicle. They have the same thing, seminal vesicle. And this is again the ureter entering into the urinary bladder. And watch very carefully now. You look at your picture. This is the urethra, and the urethra passes right through here where there's a little bulb. What does this bulb represent? Look at the picture that I gave you. This is the cat prostate gland, testicle. Here's the urinary bladder. Here's the urinary bladder. Here's the urinary bladder. Here's the urethra. And this part that bulges out, that is the prostate gland. And it passes through the prostate gland and now enters into the penis. So the penis is right here. Here's the tip of the penis. And this is the testis, where I remove the scrotum. And lying on top of the testis, which is not really shown very well, would be the epididymis. So we have to separate the epididymis from the testis itself. So if I separate it, the tissue that covers it would be the epididymis. So here's the testis. Here's the penis. Here is the very testicle where it bulges out. The bulge is right there. Make sure I'll clean it up for the test. Right there would be the prostate gland. So that's the male reproductive system.